Hey, everybody. Welcome back to the Healthy, Wealthy, and Smart podcast. I am your host, Dr. Karen Litzy, owner of Karen Litzy Physical Therapy, located in New York City. And today we're going to talk about something that I can talk about all day, that sort of connection between our emotional health and our physical health, how both of those connect for pretty much everything. And to help us today, I'm really happy to have on as my guest Dr. Elizabeth Letchford. She is a clinician, a researcher, and an artist with a PhD in kinesiology and rehabilitation science. She approaches health and movement through the lens of emotional wellness. So it's the perfect person to talk about these intertwined parts of our human experience. So, Liz, welcome to the podcast. I'm happy to have you here.
Thanks, Karen. I'm so happy to be here.
And now, can you, before we get started, would you mind telling the listeners a little bit more about yourself and how you landed in this intersection of physical, emotional well-being and how that happened for you?
Oh boy. Yeah. Well, I trained as an athletic trainer, and continue to do my research in athletic injuries. And so my PhD research big project, the dissertation, was on the subject of why female athletes, soccer players in particular, are more susceptible to ACL or lower extremity knee injuries, which is like the common pandemic that we speak about when it comes to female athletes and injuries. And through that investigation and deep diving my entire life into this question, I realized that whenever you look up emotions, what's going on in the psyche when it comes to injuries, all of the research out there is after the athlete's gotten injured. And when I was interviewing my subjects, I was, there's these amazing female athletes, and I was kind of getting to know them. And I was curious about what is your life like, though? Like, I knew the researcher in me knew that there were confounding variables like stress. Like, hey, I'm trying to apply for colleges, and also I'm a soccer athlete, so I play a year-round sport. And met very few studies take into consideration the actual stress experience and the emotional experience and any sort of past traumatic experience that may be affecting the nervous system, which is then affecting how the body works, from a neuromuscular perspective. And so I saw that, and I went deeper into that. So after I got my PhD, I opened my own practice, and I started doing corrective exercise and corrective movement with people, and emotions would flow, and it would always correlate with an improvement in movement. And so I just started diving deep into the biopsychosocial model of human movement, and it's been incredible. And the biggest takeaway has been the stories that we tell ourselves affect the way our body moves.
Which makes perfect sense to me, given I'm a physical therapist and I see this all the time. How do you explain that to someone coming to you because they feel they might need help with movement, and you say, well, it might be part of a past trauma or the stories you tell yourself, and people are like, wait a second, I thought I came to you because you're a kinesiologist and you have your PhD. Why are we talking about this? So how does that conversation happen? And I ask that because there's a lot of clinicians that listen to this podcast. And so I think your advice can be really helpful to those clinicians as well.
You know, uh, I've had a big shift in who actually is magnetized to the work that I do. And it came with the evolution of myself, started to magnetize patients, clients who were in resonance with my awareness of my own emotional experience. And so the extent to which I could hold emotional catharsis was parallel to the extent to which I could hold my own emotional catharsis and my own emotional understanding of, hey, this tightness in my hips was actually a belief that I was holding on to, or a fear that I was holding on to from when I was 3 years old. Or, for example, I was never able to enter into biomechanically effective squat. My ankles were tight. My dorsiflexion was so limited. My hips wouldn't internally rotate and my lower back wouldn't flex. And whenever I did, I would get this response in my body of panic. So my heart rate would increase and my breath would increase. And I went to years and years. It's one of the reasons I even came into this profession, which I'm sure a lot of clinicians can understand. Like, oh, I had this pain in my shoulder. I looked into it, went to my own physical therapist, and then fell in love with the profession. So same. And so for years and years and years, I couldn't figure out why my body feels broken in this way, why my fascia is so tight, why I get a panic response whenever I do this. Well, I actually turned to a somatic release therapist. I did internal family systems. Are you familiar with internal family systems? So
No.
it's a psychological framework of this understanding that we have different parts of us. Like I have a little girl part, and I have my like mother part, and I have my protector part. So there's all these different archetypes, right? The Greek theater used to, they kind of, it's a derivative of that. And I was investigating this part of me that by going into the sensation in my legs, in my inability to get into the squat, there was an emotional catharsis. And without having any memory, any visual cognitive memory of this, my legs started kicking. I started acting as if I was saying, get off, get off, get off. And I was like, whoa. And because I have the training I do, I was like, well, as it was happening, I'm like researching myself, which is kind of our plight as clinicians. I was like, ooh, what's happening? And I was thinking, wow, this must be pre-verbal because I have no memory of anything like this. I'm lucky enough, privileged enough to have no memory of me needing to say get off of anybody with anybody. And so I called my mom the next day and I said, hey, did anything traumatic happen to me or my body when I was a baby? And she knew right away and had never told me this. She was like, yeah, when you were young, when you were 6 months old, you used to hold your breath, turn blue, and pass out. So we were freaking out. We took you to the hospital. And as protocol, back in the 80s, they would test for meningitis. So I got a spinal tap at 6 months old, which the standard position for a spinal tap, I don't know if it's still this, is flexing your spine, flexing your hips, and dorsiflexing your ankles. And so no amount of myofascial release or dry needling or any kind of process was ever going to help me until I completed a somatic fear. And so that completely changed everything for me because now I'm like, holy moly, I have been trying to increase my dorsiflexion to feel strong in my squat for over 15 years and with absolutely no progress, only frustration. And immediately my body started unwinding itself. I started doing like spiral motions, unwinding, crick, 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 click in my pop and in my hip, and eventually got to get into a deep squat without pain. And I just was like, oh, what? And so it completely changed everything for me. And so then I started getting really, really curious about, well, what else in my tight body or my clients' tight bodies is actually derived from a story they were telling themselves, from a trauma, from a reenacting, a fear of reenacting a past fear. And it just completely changed everything for me.
And when you said you sort of you had to completed somatic fear, what does that mean?
Oh yeah. So if we have an unresolved trauma or a story in our mind, like it's not safe to be powerful, it's not safe to make money, it's not safe to whatever your story might, it's not safe to be a woman. Like there's a lot of stories we tell ourselves subconsciously. And each one of those stories is begging you to complete it to find the empowerment. So our systems, as you know, homeostasis, are always trying to maintain harmony. Well, our emotional systems are also trying to do that. So through our relationships, or our lives, we tend to play out those parts of us that are trying to complete the trauma and like, okay, trying to prove and prove and prove, I am worthy, I am worthy. But there's a root story. And if we can unwind our subconscious enough to get to that root story, it actually has physical manifestations. And that's what happened to me. I could have never imagined I could have never imagined that was the story, but my body remembered, my body kept the score, as is such a
As the book
popular.
says, yeah.
Yeah, exactly. And so when I mean complete the trauma, it's no longer reacting, or we say reacting because we're literally acting out a fear in the past. We are no longer present or calm. We are now, some people might call it a flashback, or maybe we're in anxiety. We're in the past, or we're in the future. We're not in the present. We are reacting to a situation. When we can complete it, meaning find the empowerment of it, find in our flesh, in our systems, in our fascia, in our nervous system, we can, and in our brain, because they are not separate, in our subconscious and in our conscious brain, we can come to peace with the story in our mind and our body. That is a completion of a fear or a trauma. And it's just like, the feeling of forgiveness, or the feeling of like, wow, that thing used to bother me so much, and then I realized I just needed to, experience deep unconditional love, because I never got that as a child, or, whatever you're going to therapy for, like it plays out in your actual physical body. And so I see that over and over and over again with the people that I work with.
Yeah, and I think your story is a really powerful one. And it just goes to show that interconnectedness that we have between our emotional self and our conscious and subconscious. And because you were like, well, wait, like my heart rate would go up, I get this. It's not like you're making that happen and you're not imagining it, like it's happening. And I have told this story before on the podcast, but I have a long history of chronic neck pain that is now for the most part under control. But a couple of years ago, again, when I didn't really have any pain, it was 2016. I was in Disneyland in California, in your state, your home state. And I was with friends, and we waited in line to go on what I thought was some sort of a jungle cruise. So you're in line for what, 40 minutes, right? If you don't get the fast pass. So we're in line forever. We're outside. We finally get inside and we get up and there's warning signs everywhere of like, neck and back pain, or if you have back pain, like warning, 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 right? And so immediately when I saw those signs, it wasn't like, oh, let me think about this. Is this going to make me immediately sweaty palms, pupils dilated, heart rate up, respiratory rate up, darting around. How can I get out of here? Looking for a door to get out. And that was automatic. Now, luckily, I was with two physical therapists who are very in tune with the biopsychosocial model of pain care. And they were like, okay, it only tilts 10 degrees, 10 degrees. It starts and it stops. You start and stop all day. You're in New York, you get in a taxi, you start and stop. You don't have any problems. It just tilts it. So for me, it was an explanation of what to maybe expect. And so I did get on the ride and I got off and I was fine. And then I went on another ride and I was fine. Now, if I didn't, I would have gotten off and I probably would have had neck pain, even though I never went on the ride, because then I would have felt bad. I would have felt bad for my friends. I would have felt like a loser. I would have felt, and you use the term broken, which is a word that I've used in the past. But instead, I was able to get on and get off. And I was like, I feel okay. So all of a sudden, my nervous system, the dial went down by like, I don't know, a lot. And then I was able to go on another ride and had a lovely time.
Wow.
But if not, my nervous system and all those emotions would have taken it was overwhelming if I didn't have those people with me.
And that's our threshold. That's our like bucket of capacity to hold. And
Mm-hmm.
oftentimes we get disease or dysfunction not when we are overloaded. And so that's the unique thing about pain is it's really just once you reach capacity, that's when you notice it.
Mm-hmm.
The impetus is usually always there, especially if it's a subconscious pain, a subconscious manifestation of the pain. There's usually the root cause is always there, but it's just like when everything else, the inputs, the sensations are filling your bucket and you overflow.
Mm-hmm.
So any ways that you can let out the bucket a little bit,
Right.
by having your friends like walk your mind through, because our mind causes most of our psychological pain,
Mm-hmm.
to walk your mind through the logical safety to be like you're safe, and once your body
Right.
feels I'm safe, some of the water leaks out, and now you got some capacity. So maybe if you get thrown around a little bit, your neck has to contract a little bit, and
Mm-hmm.
it's not overwhelming to your system.
Right. And I loved again that you used that word safety. Um, there's two researchers, Lorimer Moseley and David Butler, out of Australia, who talk a lot about pain and movement. And they have this part of a new book they did, Explain Pain Supercharged. They talk about sims
Yeah,
and dims, which is safeties in me and dangers in me.
I love
And the
that.
hypothesis is if throughout your day you have more safeties than dangers, you'll have less pain.
Sure.
And so, can you fill up your life, to your point, with more safeties? And
And
what
that's
does
what
that look like? And it's emotional. It's sensory. So what you smell, hear,
yes,
touch,
yes.
see, it all comes into the brain, and it all affects what we do every day, how we move, how we think, and what we feel.
And that's one of the things that I teach clinicians, actually, is people who are holding safe space or who have a desire to hold safe space because they're noticing that their patients are having emotional release, and they're like, I wasn't really trained for this.
Right.
I'm not a therapist. And it's like we're getting to a place where, because therapy, somatic therapy, talking about your feelings is less taboo, people and the patients we're working with are more open about it. And so, what used to be reserved for just like hairdressers and therapists, we're now experiencing in the clinic. And
Mm-hmm.
so, what I teach people how to do is it's really internally. So, like I said, the more that I was able to hold my own self and understand and feel safe with my emotional like depth and breadth in each of my archetypes, in each of the categories of emotions, the more that I wasn't affected, I didn't feel energetically drained by other people's emotional
Mm.
catharsis. And I started magnetizing patients who had very complex trauma, who had been to all the therapists, all the everything, and needed something that was more integrative. And so that's one of my passions, is teaching people how to expand their capacity to understand and feel safe expressing the different parts of themselves. I call them different archetypes. And then once you meet them in someone else, you're like, oh yeah, I know that. Even if someone's rude, you're like, listen, I know rude because I've met that in me, and I'm not
Mhm.
othering it. And so, like, I understand that at the core of rude is usually sadness. And so it just poof, it breezes right past you. So when you have your rude patient who desperately is in so much pain, clearly, and so much sadness, you're not
Mhm.
putting up an energetic wall like, what a you know what. And you're really able to hold it and actually help that person. So once I started stretching my archetypes, I started magnetizing the wildest stories, deep, crazy, complex trauma, and able to not have that be so heavy for me.
Right. And I think that's really important for a clinician because it's a fast track to burnout,
Sure.
right? That, I mean, it's great. Like, empathy is a huge part of being a clinician, it's a huge part of a motivational interview, right? To try and get people to open up and create that therapeutic relationship. But if we're taking everyone else is in, and then we don't know how to let that go. Yikes, right? So
Yikes,
that's a big super speed highway to burnout. And
yeah.
and place on top of that, I mean, I don't treat this way, but there are therapists who are seeing 14 to 20 patients a day. So can you
Really?
imagine? I know. I know. And so can you imagine how many layers,
You can't go deep with them. Yeah, you
right?
can't. And that's okay. And like that's great volume and but yeah, you actually can't. You couldn't possibly really
Right.
go
And
deep
so
emotionally.
if you can't get in
Mm.
at that level, do you feel like you're might be missing out on a an opportunity to help that patient? What are your thoughts on that?
I mean, it depends on on what your intention is as a practitioner. To be quite honest, if your intention is to make as much money as possible, then you're doing what you're doing, and
Mm-hmm.
like don't if that's your story, would go for it. Or you could charge more if you feel a calling to go deeper with your patients. You could charge more by being an epic space holder and actually diving into the root cause, because there's always an emotional, always a subconscious cause. And I was one such peer-reviewed or die clinician, like if it's not in the journals, I'm not going to do it. It's not safe for me. And that was me actually not trusting my intuition. And it took me years to be able to really trust the both my intuition and my clinical training, and
Mm-hmm.
to weave them in and be a human with someone and actually be like, hey, we all of this happened in relationship, all of your insidious onset pain, which is my specialty, happened in relationship. Your ACL tear happened on the field, but why were your hips weak in the first place? Why do you have not access to your pelvic floor? Why are your obturator internus so tight? Why? And you get down to, because I don't feel safe in my body. And if you
Mm-hmm.
take any injury, even if it's a catastrophic injury within reason, like,
Sure.
you get hit by a car, it's different. But if you have any sort of like non-contact injury, you can usually trace it down to here's how I didn't feel safe in my body or safe in myself. And so being able to have the training and the emotional wherewithal and the energetic capacity to hold that, what I've seen is so much more impactful than when I was just doing all of the, let's do the biomechanical measurements on people and get the goniometer out for whatever that's worth, and like, stretch this way and let's do some TheraBand, like, no. And so that all comes after I reset the nervous system.
Mm-hmm.
So there's a nervous system, we'll call it an archetype, an imprint that this person, any one of your patients, is holding. And that injury has a nervous system imprint. We'll call it a character. And so whenever that injury happens or whenever that pain gets exacerbated, it's because their body is embodying this character. And that character might be them when they were 5 and like daddy was really scary. And so a trigger would happen at work or on the soccer field, and their coach yelled at them or whatever happened at
Mm.
work, and they automatically go into the character, the nervous system archetype of daddy did something scary, and their body reacts in fear, even though they're perfectly safe. Actually, in the moment, their body's living in the past. And so unearthing all of those characters is so fun and has to happen through the subconscious. But awareness of how the nervous system works with the subconscious is an impeccable skill for a clinician to have. It is knowing that, hey, I don't think that all of our dry needling is working. And I've tried everything. We're doing all the fancy eccentric, repositioning. We're throwing all of our knowledge at it, and we're still seeing a regression, or we're seeing like a very small improvement. Maybe there's something subconscious going on here. Now you have a choice as a clinician to say, I feel comfortable holding that, or I don't feel comfortable holding that. And then you invite the patient to go see maybe a somatic practitioner, someone who does mind and body, not just mind, so that they can start to get connected. But I really recommend to any clinician or any person who's working with a clinician to start to just ask, like, what is the story here? What am I believing actually? Maybe I'm not getting better because I'm not fully diving into or releasing my grief about my knee, my anger about my knee, and that's a lot of insidious onset and chronic pain, is just I haven't had a safe place to feel, or who am I if I admit this, or I'm not that, and shame. And so the fear and shame, we will do anything as humans to avoid fear and shame. And so just the awareness of that in ourselves and in our patients is so powerful.
And something that you just said, like, who am I, without this or with this? And I think something interesting can happen in people with more long-term or persistent pain is if they don't have the pain anymore, which is essentially, we think, what they want, but who are they without it? And that's fearful to say, okay, well, now I don't have pain, but wait a second. Well, what does that mean for me?
Yeah.
Or when you have people, I can speak to my own experience, but I had pain every day, right? Every day for like, I don't know, 7 or 8 years. And I remember as the pain started to dissipate, I remember waking up one morning and being like, oh, okay, I don't have any pain. Wait a second. And then I was anxious that I didn't have pain, because then you're like, well, of course it's going to happen. Like, you're always waiting for the other shoe to drop, and I'm sure you experience that with some of the clients that you work with. So how do you help navigate them through those really choppy waters as things are getting better for them?
I
But
love this.
there's the fear and anxiety around all of that.
Yeah, I see that in so many manifestations with the people that I work with. People who have had this story since they can remember, since they're 5 years old. And they actually have to, it's like a bird that's lived in a cage and knows its walls and knows its limitations, feels safe, understands who it is within the context of the cage. Something in its nature realizes that it's a bird and it wants to fly. And once it's let out of the cage, it's like, oh, but who am I if I can fly? And so we do this strange thing for survival, where we tangle up our pain into our egos and our identities, and we say, I am this pain. It's not the pain, because the pain represents a story that we're telling ourselves. So, for example, my pain was the story that I was saying was, I'm not safe to surrender. I'm not safe to let go. So my pupils were huge since I can remember. They were huge. I was constantly in a state of panic. My whole system was in a state of panic. I mean, you don't get a PhD unless you're like in a state of panic, like I got something to prove.
I think that's probably true. Yeah.
Yeah. So I was like, go, 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 because if I surrender, if I stop, I might die. That's the non-logical story I was telling myself. And so my identity of I'm not safe to surrender is actually feels safer than who am I if I can fully surrender to all of my pain, all of my pleasure, all of my sensations. They did this study. I'm not sure what the journal of the study was, but this study was published where they would electrocute small electrical zaps on a metronome cadence. Okay, so at a cadence, you could expect zoop, zoop, zoop.
Mm-hmm.
And then they also did it where there was still the metronome cadence, but you didn't know whether you were going to be zapped.
Oh, that's the worst.
Exactly. And that's what they found, where it's like
Yeah,
you'd literally have less pain, but the safety in knowing that you can expect pain is more safe to your body. So we'd actually
sure.
choose the lesson there is we choose familiar even if it's more painful. And so what I
Mm-hmm.
help people do is lasso those stories. I involve a lot of ritual theater in the work that I do. So my work is highly unconventional. It's rooted in deep science and nervous system and somatic release, but I don't know who else is doing this. So I do a lot of like scene play and ritual theater where I'm actually acting out your subconscious, or I'm speaking to a relationship and becoming one of the constellations in your life. So I'll act as your mother and you can scream at her and have this relational dynamic in person. So it's like if internal family systems like had a face and a flannel shirt on, that would be me.
Mm-hmm.
And so I give people an opportunity, and then we do the somatic unwinding, and then we do fascial release because we released the tension that was holding all of that contortion together anyways. And so it takes a lot to have the emotional courage to say, oh, this thing that I don't want to admit that I am. I'm holding on to my pain. I like it here in being suppressed. I
Mm-hmm.
feel safer being in this toxic relationship. We don't want to admit that. We want to say to the world, I'm a victim. I'm sorry. He's so mean to me and da 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 da. And it's like, sure, within reason, like for the most part, like you like this. And so that's what we find when we go into the subconscious, and I help people feel safe admitting that, and then it's like the weight is lifted off of their
Mm-hmm.
shoulders. They've admitted the thing that they've been so scared, that's been held up in their nervous system to admit, and they feel free and they feel light and they laugh. When we can laugh at our silly things, that's the best. It dissipates all the energy. And so that's my artistry, as I get people to see the silly narrative that they're telling themselves, and we play it out in either in with the body or
Mm-hmm.
psychologically, and then we laugh about it. We get to the resolution of that trauma. So
And how do you incorporate, or do you, I should say, incorporate breath work or breath work techniques into what you do as well?
yeah, so I actually, from this embodied understanding of our nervous system's ability to pull us into the past, even though we're in this present moment, I developed a breath practice I call Spirokinetics. It means breath movement. And so what I have people do is I have them pull in their entire capacity to inhale and then their entire capacity to exhale. So they breathe out all of their air. So we're really engaging the diaphragm here. And then what I have them do is I put their awareness on the tension that they feel in that inhale. And so that's a measure of the amount of sympathetic tension that's in your system. It's something that they can hold on to and understand, like, wow, I'm in panic. Now the extreme version of that is a panic attack, where you're so in that tension field that you can barely breathe in. There's a wall
Mm-hmm.
there, and you can barely breathe out. There's a wall. So the wall, at any given time, if you're not in a panic attack, you have some sort of tension. Now the
Mm-hmm.
goal is pure presence, pure flow state, as the athletes will say, pure flow. And the breath is smooth and easy. And so if we all just breathe in fully right now, you can feel as you inhale, the straw starts to get smaller and smaller and smaller. And then same on the exhale, the straw, it's easy to breathe out. And then it's like, ooh, now I have to actually push to get out. And so in Spirokinetics, the inhale is a measure of you showing up in presence, how you should. And the exhale is a measure of how safe you feel to let go of who you were in that moment, in that inhale, so that you might inhale again into actual presence. So it's letting go of that identity and breathing into what you're supposed to be doing, who are you in this moment? And so the breath, that spirokinetic breath, is what anchors the practice. And what it does is it keeps people in presence while they're unwinding everything from the past. So I'm not a therapist. We're not going into the past. We're actually saying what is showing up and poking you and torturing you in the present moment. What stories? We don't even need to know the stories. You are going to unwind. And what happens is people then, as they notice what they do with the tension that they notice, I have them put that tension in their body, and every single person starts to unwind along the fascial lines themselves. So I'm teaching them how to access their body's own internal wisdom to unwind. And the thing is, they'll start putting themselves in positions that look like yoga positions, just intuitively. They'll put themselves in positions that look like chiropractic positions intuitively. So I really teach people how to tap into their body's own wisdom to know how to release their system. We all know, like, you work with someone, we've had even patients, we're like, no, it's a little, oh no, it's a little, let me just do it. Our bodies know exactly what we need. We just haven't been given permission to listen or even taught how to listen. So that's what I do.
Okay, that sounds amazing. Now, I mean, I know I've certainly have this happen, but how do you react if someone gets emotional? And I'm sure a lot of clinicians out there can relate to this, that sometimes people may start crying or, you know, eh, or or maybe start to hyperventilate or start to have these physiological reactions to movement or breath work. So, what do you do in those cases?
Yeah. Oh, I'm so glad you asked that. So it's really important, if you're ever to venture into this work, even intuitively, to become trauma informed, to know the signs of someone going back in and replaying a trauma, of being in the overload state, and helping them somatically and psychologically return back to presence. And a lot of that is just orienting to your environment. There's certain touches that can or cannot, depending on what the person needs, be very helpful to contain somebody's panic. Um, um, and the whole point of working with me is to allow space to get emotional. So what I do is I hold deep safety and containment. So emotions don't feel safe if there's nowhere for them to go. If it's like, I don't feel held, I'm sitting here, we've all, maybe we've experienced it, where I'm at a party and something triggered me and I get emotional, and it's like no one's holding me, and you kind of feel like, wow, this isn't the right place for it.
Mhm.
So if you feel really safe, which most of us feel safe with, like, our deep intimate partners, our best friends, we feel safe to finally, they're like, are you okay, honey? And you're like, ah.
And then it
You
just all comes
finally,
out.
yeah, you finally feel safe to let go. So that's what I do. And I teach people how to actually hold that safe space and to find that safety and to not be afraid of those big emotions. For me, I don't remember the last time I was like, oh, that's a lot, and people have been screaming. People have admitted to gnarly things. They have gone into a memory, like opened up a memory of something really intense that happened to them. And all of it is, because I've gone there in myself, it's like, I know, I understand. Like, I'm here for you, and I'm not trying to fix anything. I'm just guiding you and being a wall that you can thrash against if you need to. I'm going to be soft arms to hold you. So whatever that part of you needs in the moment, my mastery and my continual working towards mastery is, can I shape shift and match you as a
Mm.
being? Can I shape shift my emotional state to be what you need in this moment? And the shadow of that has been, growing up, I was a people pleaser. I would shape shift to become what people needed. And so
Mhm.
now I realize the therapeutic
You can harness
efficacy.
that as a superpower
Yes,
now instead of
yes. I'm
it
like,
being like
oh,
a people pleaser.
yes, like, oh. And so, I had to negotiate with myself, like, it's okay to shapeshift. And that has been my gift now, is showing up and being the thing that somebody needs. And It's been really liberating for myself and others to just be okay and to be a safe space for people to show up no matter what. Actually, no matter what.
Yeah, well, it sounds like something a lot of people I know, with including myself,
Yeah.
it's one of those things where like, man, I wish I knew about this,
Yeah.
you know, 10 years ago or 15 years ago.
I
Would have
get it.
saved myself some years, maybe not. I don't know.
I get it.
Hindsight is always 2020, right?
Yes.
And so I want to talk a little bit about Body Church, right?
Yeah.
Upcoming
Yeah.
program that you have. Um, so talk a little bit more about that. Where can people find it? What is it?
Sure. So I've created a place for my community and anyone interested in exploring these different archetypes. And okay, I need a safe space to move, and also if I want to cry, or if I want to laugh. Like I've created a space. I call it Body Church, and I invite people. I teach a weekly class where that's virtual, and then I also have a place with almost different tracks, like different curriculums. Where so the main Body Church class that everyone comes to every week is always a takes you on a journey using the spirokinetic breath technique. And I take you on a journey through different archetypes. You kind of get to understand and get a little taste of like 4 or 5 different archetypes. Now, I teach the whole thing in freestyle spoken word poetry, which is where art and science meets. Because poetry, they've done studies, even on babies, they're just like so present because they're trying to their brains are always trying to complete, like, what's the next word going to be. So I teach it in rhyme, and I guide you through these different archetypes in rhyme, so your brain doesn't have to think about anything. It just kind of latches on to the little story I'm telling, this little lullaby that I guide you through for 40 minutes. And then once you get into the membership, Body Church membership, there's curriculum and courses. For example, I have something called Dragon School, which is for people who are really craving stepping into their power, and actual embodied power. They might have noticed, like, man, every time that my boss tells me, like, tells me to do something, like I feel this reaction in my system, and I don't have a good relationship with my true, safe, embodied power. I call that archetype the dragon. And for me, I always got a dragon behind me, so I don't have to be the dragon. I don't have to breathe fire every time somebody does me wrong, because I'm like,
Mm-hmm.
I can be myself and present because I know if I need to. Your girl's a dragon.
Uh-huh.
And I actually, so the only place that I really discovered there's any sort of training around space holding, going into catharsis, somatic sensations, whether pleasurable or painful, was actually the a dominatrix. And so I trained with other dominatrixes in dominatrix school for 6 months to immerse myself in the world of somatic space holding at the deepest
Mm-hmm.
level. And so Dragon School is what I wish that I had, which doesn't necessarily have to be super kinky, doesn't necessarily have to even be in the sexual space. Because all of you is welcome, sometimes people experience pleasure, but we're not going into pleasure. It's just, can you embody your dragon enough to hold impeccable space for yourself and others? And not be afraid of being dominant, not being afraid of being in surrender. So that's what you get at Body Church.
Mm-hmm.
You get a beautiful art meets science, like safe on both ends, meaning it's
Mm-hmm.
rooted in physiology. I studied the body, all, and then also, like, I love you, and so come, and we're going to have a safe space, and I'm going to teach you how to listen to you. I'm not telling you how to move. I'm helping your body's wisdom come online. So that's the premise of Body Church, and the community's epic because it's a bunch of people who are like, Yeah, I respect professionals, and I respect, people like us who are just like, hi, I'm here. I've got the training. And in order to collaborate in my therapeutic interventions and have some say and not give all my power away to, people like us, clinicians who also
Mm-hmm.
are like, I don't know, I'm not in your body. Here's what I learned in school. Here's what my intuition is saying, but like, the best thing
Right.
for you. And so I help people advocate for themselves through embodying these different characters and allowing a place where you can move and cry. I've been to yoga classes and I'm like, I just want to cry or scream right now.
Mm-hmm.
And then because that trigger happened in my nervous system, but it wasn't the environment where I could do that, it kind of gets stirred up. I kind of feel cranky the rest of the day. So
Right.
Body Church is a place where all of you is welcome and you stay safe in the present. We're not going into past stories. You're like, your nervous system stays in the present. So it's a very safe space to unwind.
Well, where can people find it if they want more information? Or
Um,
find you, I should say. Find
yeah.
you, find that, find more information about what you do. And if someone is listening to this and saying, like, man, I would like to work with you, how can they do that?
Yeah. So please, 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 if this resonated with you, if you feel, if you feel a deep connection to the work or you're curious, send me a message. You can find me at lizletchford.com. And if you're curious about Body Church, if you want to come unwind and learn Spirokinetics, that's bodychurch.com. And then I also, if you're curious about what the heck, Liz, what is this ritual theater, like a therapeutic theater thing that you do where you embody other people's characters? I put on performances all over the world. So I do a show where I take people through a live experience live on a stage where I poetically tell the story of their nervous system. So in that way, I call myself a body whisperer because I don't know what else to call myself. I'm like, I'm no longer an athletic trainer. We're way outside of scope.
Uh-huh.
and so body whisperer is how I practice. And yeah, so that's what I've come up with. And it's been so effective and so fun for me. And also like just the people that I've met who are so magnetized to this kind of work where it's the human. I'm meeting you at the human level. I'm not sitting here saying, hey, I know what's going on with your neck. I'm saying, let's talk about what might be going on with your neck. I want you to be an equal part of this.
Mm-hmm.
Yeah.
Yeah, perfect. And now, before we wrap things up, I have one more question. It's one that I ask everyone. Knowing where you are now in your life and your career, what advice would you give to your 20-year-old self?
Oh, her 20-year-old Liz. Let me talk to you, honey. Listen, you're gonna feel some crazy stuff. And I really want you to know that it's all for a reason, that all of the pain that you're going through, all the struggle that you're going through is strengthening you and training you for what you're gonna hold in 15 years. I promise you. So it's okay. Feel it. Don't not feel it, baby. Feel it.
Excellent advice. Well, Liz, thank you so much for coming on the podcast today. And again, if you missed it, you can find out more about Liz at lizletchford.com. We will have links to everything. So if you're watching this on YouTube, well, if you're watching this on YouTube, you'll see how well we coordinated our outfits for today without even speaking to each other ahead of time. And if you're not, and you're whatever platform you're listening on, we'll have links to everything in the show notes. You can just go down to the show notes and one click will take you to all of the links that we mentioned today. So Liz, again, thank you so much. This was great.
Thank you so much. I appreciate it.
And to all the listeners, thanks so much for listening. Have a great couple of days and stay healthy, wealthy, and smart.